my name is Elmira Strange and I'm a research psychologist and your tutor in this course. First of all, I would like to welcome you to this course. And congratulations for taking this step towards helping to someone you know, or perhaps a helper, or even a professional substance misuse worker that help hundreds, if not thousands of people around the world. Alcohol and drug addiction is real, and it's becoming a more and more global problem for many people. Nobody argues that it's harder to live these days. The economic stability, well, it's not stable at all, and that is observable in every country. More and more people try to cope with their personal life circumstances, with negative life experiences through their addiction. But at the same time, a lot of people want to quit that habit. They know how destructive it is, how damaging their addiction is to their health, their family, their life, really. And this is where you come into play, either as a volunteer or as a helper or a professional misuse worker. So if you would like to become any of these, then you're in the right place. In this course, you will learn quite a few different things that can help you to attain those skills that you need to become either a professional helper or a volunteer or a helper to someone you know. For example, you will find out what is intervention, how they do, or what is 12-step program, or what is the Minnesota model, which is based on 12-step program. That is also important today in treatment of particularly alcohol addiction. And what sort of drugs and medications they use today for treating drug and alcohol dependency. All this and so much more you will learn in this course. So, once again, congratulations for taking this course. Welcome to these lessons. Participate in them. Take notes as you go along. Try to reflect on each lesson, on what we've been discussed after every session or after every lecture. Go till the end, complete all the lectures, and receive your certificate of completion as well. See you in our first lecture.